Good morning, good afternoon, and good evening, philosophers. Today, we are exploring a radical position in the philosophy of medicine known as medical nihilism. This is the 11th episode in our series on philosophy of science through the lens of medicine, and perhaps introduce something you've never heard of before. So, simply put, medical nihilism is the view that we should have very little confidence in the effectiveness of medical interventions. At first glance, this might seem like a strange pill to swallow. Excuse the pun. After all, modern medicine is amazing. Patients place great trust in its products, practitioners, and institutions. But to understand why serious thinkers entertain this profound skepticism, we must first look at history. I want to be clear, a medical nihilist doesn't necessarily deny the monumental triumphs of medical science. It's undeniable that medicine can mitigate much suffering. History provides spectacular examples of human ingenuity conquering disease. Think of Edward Jenner's pioneering work on the smallpox vaccine, which eventually eradicated one of humanity's greatest scourges. Consider the accidental but world-altering discovery of penicillin by Alexander Fleming, which revolutionized our ability to survive bacterial infections. And we must acknowledge the sheer miracle of anesthesia, which transformed surgery from a brutal, agonizing ordeal into a precise, life-saving art. Even the most ardent 19th century medical nihilists exempted anesthesia and a few other specific cures from their scorn. Yet, alongside these triumphs, the broader history of medicine is littered with interventions that were not only ineffective, but actively harmful. For centuries, the standard of care included practices like bloodletting, draining a patient's blood to balance their humours. In the 20th century, we saw the tragic rise of the lobotomy as a treatment for psychiatric distress. These weren't fringe practices, they were literally mainstream medicine. Because of this track record, skepticism has very deep roots. As far back as antiquity, the Greek philosopher Heraclitus claimed that doctors were just as bad as the diseases they claimed to cure. The Roman poet Virgil wrote a line often translated as, "The disease worsens with treatment." In early modern Europe, playwrights like Shakespeare and Molière routinely mocked the medical profession. And in the Timon of Athens, Shakespeare wrote, "Trust not the physician, his antidotes are poison, and he slays." This skepticism culminated in a recognizable philosophical stance during the 19th century, known then as therapeutic nihilism. It was a common stance in Western medicine, born of the continued importance of medicine to cure disease, despite advances in biological understanding. Prominent physicians themselves championed it. Oliver Wendell Holmes, the dean of Harvard Medical School in 1860, firmly believed that, aside from a hodgepodge of exceptions, medical interventions did too much harm. He famously declared that if the whole materia medica could be sunk to the bottom of the sea, it would be all the better for mankind, and all the worse for the fishes. So we're tempted to look back and say, well, they were right to be skeptical back then, but today's different, right? We have evidence-based medicine, randomized controlled trials, and massive research budgets. But our medical confidence might still be misguided. Fortunes are spent on research, regulation, and the consumption of pharmaceuticals, yet we still face ailments for which we have no cures, like most psychiatric disorders, deadly forms of cancer, and arthritis. Many widely consumed interventions, like some antidepressants and drugs for type 2 diabetes, are barely effective at all and carry significant harmful effects. This historical backdrop is essential. It teaches us that mainstream confidence in a medical paradigm doesn't guarantee its effectiveness. In the next lecture, we're going to examine the modern arguments that carry the historical skepticism into the 21st century. Thank you for listening, and I'll see you on the next one.